Congestive Heart Failure Within the Aging Population by Sunday Canestrino, Jane Gleave, Donnie Hill, James Collis, Kylie Sylvan, and Vincent White.
Heart failure is a progressive condition where the heart muscles are too weak to pump efficiently. Your heart is made up of 4 chambers. The upper half has 2 atria, while the lower half has 2 ventricles. The atria are responsible for receiving blood from your body, and the ventricles are responsible for pumping blood back out to your body. Heart failure develops when your ventricles cannot pump enough blood back out to your body. Certain conditions gradually leave your heart too weak or stiff to fill and pump efficiently. Heart failure is also known as congestive heart failure when it reaches a stage in which fluid builds up around the heart and other parts of the body. Left-sided heart failure is the most common type of CHF. It occurs when your left ventricle doesn't properly pump blood out to your body. As the condition progresses, fluid can build up in your lungs, which makes breathing difficult. There are 2 kinds of left-sided heart failure. Diastolic failure happens when the muscle in the left ventricle becomes stiff. Because it can no longer relax, the heart can't quite fill with blood between beats. Systolic heart failure occurs when the left ventricle fails to contract normally. This reduces the level of force available to push blood into circulation. Without this force, the heart cannot pump properly. Right-sided heart failure occurs when the right ventricle has difficulty pumping blood to your lungs. Blood backs up in your blood vessels, which causes fluid retention in your lower extremities, abdomen, and other vital organs. It is possible to have left-sided and right-sided CHF at the same time. Usually, the disease starts in the left side and then travels to the right side when left untreated.
CHF Risk Factors. Heart failure risk increases with advancing age. Heart failure is the most common reason for hospitalization in people aged 65 years and older. Men are at a higher risk for heart failure than women. Being African American, you are more likely to develop heart failure before the age of 50 and to die from this condition. People with a family history of cardiomyopathies are at an increased risk of developing heart failure. People with diabetes are at a high risk for heart failure, particularly if they also have coronary artery disease and high blood pressure. And some types of diabetes medications may cause or worsen heart failure. Having chronic kidney disease caused by diabetes also increases that risk. Obesity is associated with both high blood pressure and type 2 diabetes, conditions that place people at risk for heart failure. Evidence strongly suggests that obesity itself is a major risk factor for heart failure, especially in women. Smoking, sedentary lifestyle, and alcohol and drug abuse can increase the risk of developing heart failure. And there are certain drugs that could potentially damage the heart and increase the risk for heart failure. Long-term use of high-dose anabolic steroids increases the risk. Certain cancer drugs have been associated with heart failure.
In addition to shortness of breath, fatigue, and weakness, swelling in your legs and ankles and feet can be a big sign of heart failure. Other signs and symptoms include rapid or irregular heartbeat, reduced ability to perform normal moving tasks, persistent cough or wheezing, rapid weight gain, or sudden shortness of breath. A later sign of heart failure would include sudden shortness of breath while coughing up pink frothy phlegm. You could also experience chest pain if your heart failure is caused by a heart attack.
Once a provider has finished their assessment and they suspect that the patient may be at risk for heart failure or they have heart failure, they will order a variety of tests. 3 of them being a blood draw that tests for BNP, an echocardiogram, and a chest x-ray. A BNP, or brain natriuretic peptide, is a substance released in the blood that is a good indicator for heart failure. The cutoff is 100 picograms per milliliter. If you are above 100 picograms per milliliter, you likely have heart failure. However, if you are below that, you likely do not have heart failure. So it's a black and white kind of test. However, you could be borderline. An echocardiogram is a test that an echotech does, and what this does is it measures the ejection fraction of your heart, and the ejection fraction is essentially an equation that we use that measures the volume of blood ejected from the ventricles divided by the amount of blood in the chamber. A normal range or normal ejection fraction range is between 55 to 70%. That is a normal functioning heart. Heart failure is typically 40% or lower, and a life-threatening heart failure operates at 35% or lower, which is not good. A chest x-ray is another popular test that a physician or an NP or PA will order. A chest x-ray allows them to take a look at your lungs. Someone from diagnostic imaging will bring you to their department, or they'll do a portable chest x-ray. And what this does is it allows them to take a look at your chest, look at your heart, look at your lungs, and the physician or mid-level provider will know if you have fluid in your lungs, or see if your heart has increased in size. All of these are good indicators or good tests for diagnosing congestive heart failure, and they're very helpful.
Statistics about CHF. According to cdc.gov, about 6.2 million adults in the United States have heart failure. In 2018, heart failure was mentioned on 379,800 death certificates. Heart failure cost the nation an estimated of $30.7 billion in 2012. This includes the cost of healthcare services, medicines to treat heart failure, and missed days of work. Medications for CHF. ACE inhibitors, first line of treatment prescribed together with beta blockers. Medication that ends with pril, like lisinopril, is an angiotensin converting enzyme that blocks the conversion of angiotensin 1 and 2 that cause vasodilation. That decreases blood pressure toward the kidney, excretes sodium, and decreases aldosterone that keep the potassium and excrete sodium. Side effects are hyperkalemia and dry nagging cough. Angiotensin II receptor blockers or ARBs used in place with ACE inhibitors. Medication ends with sartan, like losartan, that directly blocks angiotensin II receptors that has the same effects as ACE inhibitors. Side effects are hypokalemia, but no dry nagging cough. Diuretics used in combination with ACE and ARBs to decrease water and sodium retention. Decrease edema and helps the heart. Always monitor for BUN and creatinine level to make sure not diuresing too much to prevent strain in the kidneys. Loop diuretics like Lasix, check first the potassium level. Potassium sparing like aldactone and spironolactone will increase potassium level, and watch if it's on ACE and ARBs. Side effects are hypotension, electrolyte imbalances, muscle cramps, polyuria, headache, and increased thirst. Beta blockers blocks neuroepinephrine effects on the heart muscles. It slows down the heart rate. Negative inotropic effects will decrease cardiac contraction, slows the heart rates, and would lead to cardiac workload. Medication that ends with LOL, like metoprolol or carvedilol. Because it decreases heart contraction, it is used along with ACE and ARBs to stabilize this function. Side effects are bradycardia, masking hypoglycemia, not for COPD or asthmatic patient. Don't take grapefruit. or grapefruit juice because it will decrease the absorption of beta blockers. Anticoagulants not used in every patient with CHF, only used with patients with heart failure and AFib at the same time, or with history of blood clots and ejection fraction of less than 35%. Side effects are bruising, prolonged bleeding, headaches, and nosebleeds. Vasodilators prescribed to patient if ACE and ARBs can tolerate. Hydralazine act in the artery and sometimes prescribed with nitrate that acts in the vein. Vasodilation of arteries and veins will decrease blood going back to the heart and decrease workload of the heart. Side effects are hypotension or orthostatic hypotension. Digoxin, positive inotropic that increases the heart's ability to contract stronger. Negative inotropic that causes the hearts to decrease heartbeat. Allows the heart to rest and pump more blood. Not the first line of treatment and used with ACE and diuretics. Toxicity issues increase changes if patient is hypokalemic. Toxic range is greater than 2 nanogram per milliliter. Signs and symptoms of digoxin toxicity are nausea and vomiting and vision changes. Always check apical pulse before giving digoxin. Heart rate should be greater than 60 beats per minute. Antidote is digobind.
How can I help prevent CHF? You need to exercise regularly. Eat your fruits and vegetables, whole grains, and lean proteins. You need to limit the bad fats, added sugars, and alcohol. Don't smoke or use illicit drugs. Reduce your stress. Make sure you get enough sleep and stick to a healthy diet. Are you ready to start your heart healthy diet? Here are some foods that you can incorporate into new recipes. You can easily search heart healthy recipes on the internet and you will get some wonderful recipe ideas from the American Heart Association.
Hello. By now you've learned a little bit about CHF. Now I think it's important that we talk about how to live with CHF, how to live with those challenges that we're now facing day to day with our new diagnosis. First of all, I think it's very important with our new diagnosis. First of all, I think it's very important that we start with a new diet. Um, New diet and healthy living is a great way to first try to start managing your CHF. That's one of the first steps that we can take in the right direction. Start managing your CHF. That's one of the first steps that we can take in the right direction. And one of the biggest things that a new CHF patient can do is limit their sodium intake. Sodium intake, as we all know, increases that water buildup. All know increases that water buildup. Where sodium goes, water follows, kind of in that pattern. So we want to really decrease that sodium intake. You're going to start seeing those big swollen feet intake. You're going to start seeing those big swollen feet, swollen lower legs. That's kind of one of those things that tells us. Even some people might feel it in their hands as say, I can't take my ring off because my hands are so swollen. I got to decrease my sodium. That's one of those things very important with off because my hands are so swollen. I got to decrease my sodium. That's one of those things very important with a CHF patient, decreasing that sodium. How do we do that? Well, we can start with incorporating a lot of fresh vegetables and fresh fruits, a little bit more fish into our diet rather than fresh fruits, a little bit more fish into our diet rather than those red meats and poultry where we see a little bit more higher sodium levels. One of the things that CHF patients often will say is, it's really hard for me to walk to the patients often will say is it's really hard for me to walk to the restroom. I get really short of breath just doing the little day-to-day things. So what do we want to do is we want to build up a good exercise tolerance. We want to basically condition ourselves a good exercise tolerance. We want to basically condition ourselves into being able to walk to the restroom easier. We should be able to find ourselves getting stronger and breathing better with just a little bit of exercise incorporated into our daily activities. Being better with just a little bit of exercise incorporated into our daily activities. Also, a CHF patient may notice that their sleep is struggling. Sometimes they might find themselves short of breath at night. Say, I can't tolerate laying down. I just need to sit up in this chair. So that night, say, I can't tolerate laying down. I just need to sit up in this chair. So how do we do that? We kind of keep our head up, head elevated. Sometimes we might be able to find a bed that can adjust the head. We also may be able to, you'll see a lot of patients that can adjust the head. We also may be able to, you'll see a lot of patients, they'll say, I got to sleep with a lot of pillows underneath me. And that's just a way to remedy that fluid, because as we know, fluid is what's bothering us. Our lungs are filling up. And what do we do? Fluid is what's bothering us. Our lungs are filling up. And what do we do? We're affected by gravity just like everything else. And so is that fluid in your lungs. So if we can bring that fluid down, we might be able to get a little bit stronger breath, a little bit more air into those lungs. So stronger breath, a little bit more air into those lungs. So just some things that may help with that day to day. So improving our exercise, sometimes positions may help, sitting in an upright position, sleeping in a more upright position. Also with CHF patients, sleeping in a more upright position. Also with CHF patients, it is very important that we stay compliant with the medication regimen that we've been given. Staying up with our blood pressure medications. So we might have those antihypertensive with our blood pressure medications. So we might have those antihypertensives. We might have some diuretics there. So those water pills that help keep that fluid off. And with that, there are some side effects to those. Well, obviously, we have some electrolyte imbalances. So that's why we want to really some side effects to those. Well, obviously, we have some electrolyte imbalances. So that's why we want to really stay on top of our diet and our fluid intake. We don't want to go overboard with certain things like sodium, like that excess water, but we still want to have a good healthy balance. So we want to have a good diet, like that excess water, but we still want to have a good healthy balance. So we want to have a good diet, staying compliant with our medications, and we should stay pretty well and stay pretty healthy and hopefully symptom free with that. Also, it's very important because we are on a new
Here are some community resources and internet websites you can look up on the internet to get more information about congestive heart failure. Social media is a great way to connect with others with CHF. Who knows? You might even meet a new friend.